I'm Roger Baker, Executive Director of the Stratfor Center for Applied Geopolitics at RANE, a global center of excellence for geopolitical intelligence and analysis. Learn how you can put geopolitics to work for your organization at ranenetwork.com.
Hello and welcome to the RANE podcast series. In this episode, founder of RANE, David Lawrence, sits down with Dr. Mark Gold for a powerful discussion on drug addiction and relapse prevention. Their discussion will dive into why words matter, and particularly how Alcoholics Anonymous and Narcotics Anonymous teach self-help groups by using language to explain addiction and relapse prevention. Dr. Mark Gold, a renowned addiction expert with over 1,000 publications since the 1970s, modernized addiction training and treatment, aiming for research-driven improvements. This episode explores his insights. We hope you enjoy.
Mark, again, great privilege and honor to be able to talk to you about a topic that is not going to go away anytime soon. And I wanted to particularly call out your recent article in Psychology Today, which I've sort of subtitled Why Words Matter, but entitled Why Language of Key Self-Help Groups Work. Basically, it is about the types of words that we use, the language we use, how we communicate with people, and what is most helpful in dealing with substance use disorder and the issues of relapse, etc. So maybe I can just begin with what motivated you to write the article?
Well, first, thanks very much for having me. I was thinking maybe that you'd get bored of talking to me, and I'm so happy that I can do these articles and that you like them.
Everyone does, Mark. And can I just say, this is the longest standing war this country has ever faced, right? The war on drugs. There's been no longer one. Yeah. Yeah.
There's no let up. Yeah. And we probably lost more people than in any war, but at least 100,000 people a year. Well, I'm not a person in recovery, but I've worked with people in recovery my entire career. And when I worked for the Board of Medicine's physician recovery programs, advocating and working with physicians and following them for 5 or more years, I could see how valuable AA and NA was to them. In addition, you could say their psychiatry evaluation and treatment was valuable, but it didn't seem to me to be as valuable as their caduceus meetings or recovery programs. So when I thought about it, I said, well, a lot of the resistance to AA and NA comes from family and friends who say, aren't you cured already? Or comes from people who focus on the powerlessness step or higher power and say they're not religious. And the professional resistance to AA isn't data-based. It's pretty clear that people do better who go to meetings, and it's very clear that it's free, that you can get a sponsor, and there's a crisis availability that's not possible even if you're in a private rehab program. So I said, well, maybe if we explain the language in terms of cognitive behavioral change or relapse prevention, people will realize just how brilliant AA and NA is. I mean, how they capture the essence of addiction and use all of the learned experience to help other people. So to start with, most people would know the saying, one day at a time. So I started with that, and then I went into other kinds of AA sayings that they might not understand, but just for one day at a time, quickly think about what it says. It's a cognitive behavioral framing tool that says don't worry about next year. Don't worry about this month. Don't worry about this week. Worry about today. Worry about doing what you said you would do today. Worry about not using drugs today. Worry about your family and friends today. Worry about today. Don't worry about the tomorrow. And don't be overwhelmed. Because if you're thinking about tomorrow or next year, you are overwhelmed. But if you're thinking about the tasks at hand today, you can handle that. And so it really, one day at a time, is just a brilliant summary statement for what you should be doing. Just for today, one day at a time. Stay sober, commit, do what you promised today, and tomorrow will take care of itself.
So, Mark, what I'm hearing you say, and people are familiar with AA and NA as they know the names out there, but the work they're doing in terms of support group, sponsorship, you underscored something that is critical. These are free organizations, right? So much of what has occurred around this space has been expensive and for profit and has not been evidence-based. But what I'm hearing you say, and it's not to say that AA is for everyone or NA is for everyone, but that these solutions, these organizations, these approaches are actually evidence-based. They are based on what people know about cognitive behavior, and that they work and that they're free.
Yeah, no, and think about it. It's not mutually exclusive. As you know, I was on the board of Betty Ford, and when they started Betty Ford, Mrs. Ford didn't even want to do detox. She wanted to do treatment and help people understand the 12 steps and how important it was, not just for not using, but in terms of teaching people and helping people relearn how to be a good person and how to prioritize their family and how to prioritize their health. It takes a long time. So anyway, I don't. When we talked about impaired professional treatment, like our physician treatment models, you would have a detox and evaluation phase. They might go on a medication-assisted treatment, but we would always have psychological treatment and some 12-step fellowship. Usually there are groups of physicians, but in your background, David, you probably, if you unmute your mic, you hear about your horns honking, and you're in New York City. I mean, there's a meeting probably every hour somewhere, and there are all kinds of meetings. They have meetings for artists and meetings for performers, and you can find a meeting that fits you. So here you have almost universal access. Rather than using drugs when you have craving, you can prescribe a meeting for yourself. You have role models, you have mentors and sponsors, and somewhere around 2 million people went to a meeting yesterday. So it's not an alien process, and there's a wisdom to it, and there have been evidence-based evaluations to show, for example, that people who have this experience are more likely to be clean and sober, are more likely to stay with their treatment program, and at least with professionals, either people who are sponsored by their business or are physicians or health professionals, we know that they have the best 5-year outcomes when this is part of their treatment program. It isn't to say that there's no other way, but right now we don't have one treatment that has monumental efficacy. And one thing I wrote about, what most people forget, is if you just looked at relapse for opioid use disorder, some studies show 90% relapse in the first few months to a year, even in people who take or given Suboxone or other treatments, they discontinue them before medical advice. And even if they continue them, they rarely continue them long enough to have the same sort of change. AA takes a very different approach, meaning that there's not a cure waiting for you, and going to meetings just proves that you're actively going to prevent a relapse and become the person that you were in the past again. So it's just, I don't know, take the saying, I don't know if you are familiar with this, but there's another AA saying that I highlighted in the Psychology Today piece, which was
Yeah, the metaphor.
cucumber
I was
and
going to
pickle.
ask you about that. That was fascinating. I had not heard that one before. Maybe you can explain it to the audience.
Yeah, I mean, thanks. It's we've found this to be useful even among people, a neurosurgeon. They might debate you, but they'll appreciate this analogy. So in AA circles, the cucumber often is used to represent the social drinker, someone who drinks in moderation, stops when they want, is under control, hasn't any major consequences, and could stop without horrific withdrawal. But once a cucumber is placed in vinegar, salt, and spices, and is turned into a pickle, it's kind of like the brain being repeatedly exposed to alcohol. Over time, some chemical change occurs. We don't know exactly what it is, and this switch process is under investigation because people know it's real. Once a cucumber becomes a pickle, all bets are off. At this point, the person responds to alcohol in a different way, their brain responds in a different way, and they've lost control. They have tolerance. If they try to stop, they have craving, and they can't return to controlled use. So it's a really poignant analogy that says at some point in time, you go from using alcohol to being an alcoholic. And at that point in the time, you can't just wish yourself back. That you'll need a lot of time to gain control over it again. And I just think it sets the stage for believing and knowing that you've acquired a chronic, relapsing, lifelong illness for which we don't have a miracle cure or any cure. We have treatments. We can put the disease in remission, and you're most likely to do that with experts, board-certified addiction medicine facilities, trained treatment programs, and then persistent follow-up to prevent relapse. And that could happen in an AA meeting in New York. It's happening right now.
Many of the AA meetings have people who attend who are dealing with substance use disorders. Yeah. So it's not limited to alcohol. I just want to make that point. But these are chronic illnesses, and their relapse, unfortunately, different heart disease, cancer, etc. People are prone to it. So it's really, this is about a lifetime battle and lifetime compliance efforts. But there is slippage, and the question is, how far off the mountain do you fall? Or do you have some cleats in the mountain that kind of catch you?
Yeah, no, that's very good. I mean, it's you think about it. AA has so much experience with the way their experience is from the person's point of view. Now, mine experience is like what happens in the brain, right? So we know that the brain's reward circuitry changes. We know that the higher part of the brain's ability to control the lower part of the brain changes. Now, Nora has called this the hijack brain, just meaning that the brain has changed so that it's not the same as it was before, and so that drugs are prioritized as extremely important to survival, almost as if you acquired a new drive state, like the drive to drink water. In this case, it's the drive to use drugs. The brain's hijacked, and now AA doesn't use the term hijacked. They'll say, you've turned your brain from a cucumber to a pickle, and that's just where you are. And that doesn't mean that you can't get better. The elevator is broken. Take the steps. That's the AA. There's no fast way on the elevator. You have to take the steps. That's what they call the 12 steps. It takes time. Easy does it.
As you referenced in the article, one day at a time, which at least in one's mind, that's a manageable goal. Okay, and so it does take time. And I've been at for these extraordinary presentations that you've done, where you sort of show the brain, when it is, addicted, and then the healing process. But the point you're making is the healing process is very, very gradual. It takes time, and it takes obviously a lot of effort. But because it takes time, what I'm hearing you say, Mark, is that I'll call it a mantra of one day at a time, and having people around you who can help support that effort, who may have been there and done that and actually understand what you're going through, are sort of critical components. There's no magic bullet, but they're tools in the toolbox. And that's how I read your article, was just, you've written a lot about the different tools that one needs, but language and I'll call it support by people who actually know what you're going through and you can relate to are critical. And you referenced the different AA meetings that, some are for lawyers, some are for, doctors. I know issues involving, people in the airlines industry, et cetera, right? So these are all, what I would say is, I'm not sure one of the reasons we're doing these podcasts is to, help educate. People may know a little bit about this stuff, but why having this kind of support that is evidence-based is so critical. Yeah,
people have their own way of thinking about things. And I know at Florida, we used to encourage the medical students to go to an AA meeting. Just not that they would need the help themselves, but to understand it. They do a lot of good that isn't clear unless you've been there. But this article, I was really mostly focused on, look at the wisdom in the language. And if you looked at it as a psychiatrist or psychologist, you would see a few simple words explain a lot. Like, how about this one? It works if you work it. There you go. Like AA doesn't work unless you're actively working. So stop complaining and do the work. Well, there's a lot to that. If you have a substance use disorder, the main work that you might be doing is worrying about where the next supply of drugs are coming from, or scheming, or selling something to get drugs. It's not a work like that. So I really liked this once I got going. It was hard for me to get started, but once I figured out where I was going with it, so I was really happy.
And I mean this as a compliment, but the simplicity of the wisdom, obviously what I think you've done is dissected AA and sort of explained it. And again, AA not just for alcohol, but substance use, but explained it. And I'd like to actually, take you through a couple of the bullet points that you made about this, and you've already referenced, and so much of this is almost like a visual metaphor, okay?
It's so funny. I'm glad you see that. I agree. And there's some of it that you go like, you mean that came from AA? Like, I'm sure everybody has heard You're only as sick as your secrets. But AA is about honesty and self-disclosure. Why is it about honesty and disclosure? Because if you don't have any secrets and have nothing to hide, you can move forward.
So the analogy, I've already given you my mountain and the cleats, but when people are carrying around a knapsack, I used to say this to my kids as they were growing up, and something was going on in school that they wouldn't tell my wife or me about, and clearly something was bothering them for weeks. I used to say, how long have you been carrying around that knapsack with bricks? Okay, you don't have to carry one. Let's put it down. Okay, let's put it down. And the notion, right, that in trying to deal with a serious illness, there are hidden secrets, and the secrets, and I know enough to be a bit dangerous here, but it's not just about the drug usage. It's about how people have felt they've betrayed their loved ones, their family, how people feel they've dishonored their profession, how people feel some have been involved in have broken the law for other reasons to support their habit, etc. There's just there are a lot of secrets and a lot of guilt that comes with this. So I thought it was great that you're as you said in the bullet point, you're only as sick as your secrets. All right, and by the way, that you don't have to be an alcoholic or addicted to for that to apply. Okay.
Well, I think it's the same thing for one day at a time. And basically, there's a lot of angst about every day in modern life right now. And they might say the Serenity Prayer, or take Easy Does It, or take one day at a time.
Okay, so let's take them through, a couple of these additional bullets, because you've done such a great job in dissecting this, Mark. The term HALT, which I thought was great, and what it stands for. Never get too hungry, angry, lonely, or tired.
It's really funny, isn't it? Like the NIDA has studied why people relapse. Now, AA has HALT. And the way to prevent a relapse is never get too hungry, angry, lonely, or tired. Well, there you go. Like when you do the scientific study of relapse, like the craving for food and the craving for drugs are often confused in the brain. And by the way, people who overeat tend to get less reinforcement from drugs of abuse. But the big triggers are hungry, angry, lonely, tired, meaning you need to get your sleep, you need to get your rest, you need to have self-care and eat appropriately, you need to manage your emotions, and you need other people. All of these are top 4 relapse triggers, and AA puts it together in the saying HALT. It's funny, isn't it? Like, they didn't put in take a shower, but they do. I didn't put this in there, but they did have fake it till you make it, meaning take a shower, shave, put on good clothes, and look like a person.
I know in some of your other writings you've talked about physical exercise and the role that staying in shape can have, right? Which is important. There's something within the bullet point that the goal is progress, not perfection. I will tell you, in so many businesses, it is elevated that perfection is the enemy of the good, because people cannot, make a decision, or they feel paralyzed, or they, things fall through the cracks because they believe perfection is the goal, as opposed to just getting some degree of progress in the task at hand.
That's the point. I agree. So again, it's another structured way to live. One day at a time, make progress today. Like, make progress. We're not built to be perfect. Someone might wish they were perfect, but I don't think anyone that's taken a moral inventory can actually believe that they're perfect. So make progress. I like that a lot. I just find it, when you think about how to live each day, the idea that AA has a method for living, a recipe book for living, is really useful for people whose substance use has disorganized their life and made a mess of it, and now they're stuck with this. How do you put all the pieces back together? They can't possibly imagine that it could ever happen, but maybe it could happen by making progress each day, each hour.
I was going to say that obviously that's also at least the implicit message in the AA meetings, where you have people who have explained how long they've been sober and what they've been through, and so there are, we'll call it, and they're role models. There are role models, right?
Yes, I do think that's really a great point to emphasize. Why do they have people telling their life story? I know I sat in on one meeting where some woman was telling her life story, and said when she first started to tell her story, she would cry hysterically. She ended up doing tricks as a prostitute to support herself, but she was Miss Missouri at one time, or some state. I made up the state, but it was that kind of a dichotomous existence, and then I know in the doctor meetings one of the doctors would say that he overdosed in the on-call room, and another would say that he took medicine from a person who needed it for pain. The things that are so when you're conscious, you could get so guilty about that you can't possibly move on. And I think that by people seeing other people and how they've managed to move forward in spite of these challenges, it's inspiring for them. It's a roadmap for them, and they are role models for them as well. And they're teachers, so they're teachers, role models, and mentors. And some of the relapse prevention sayings are teachers, maybe you can think it through. I use the word play the tape, which mean think it through. What happens after you do this? What happens after you use the next one time? Well, what's going to happen? And again, AA says this feeling that you have will pass. This too will pass. Do the first things first. Prioritize sobriety. Go to a meeting. Talk to a friend. Call your sponsor. I put call your sponsor in, even though it's not a saying. But all my old patients used to say, when in doubt, you can call your sponsor. I know that I can't call you or my counselor. It's the middle of the night, but I could call my sponsor 24/7.
So let me, for the purpose of the audience, the term sponsor can mean different things to different people, but in the AA context, as I've understood it, basically people serve as sponsors and people have sponsors. Even the sponsors have sponsors because, as you note in the article, relapse is part of life. It just happens, and the ability to avoid relapse or to reach someone if relapse has occurred is critical in the recovery process. And these are people that you have met, teamed up with, whom you can trust, who are reachable 24/7, who do not cut you off after a 50-minute hour. Okay, no disrespect to psychiatrists and psychologists, but who are there for you. I mean, they're your Sherpas in the recovery process, and you know.
It's funny, I mean, most people, it's almost like going to graduate school. There's even an AA sponsor guidebook, and basically they define what the roles are and what are the responsibilities of both the sponsor and the sponsee, and what is a good partnership, how to find a sponsor, and what a sponsor's roles are, and where it begins and ends. But principally, the sponsor's job is to help the person who's junior in the sense of recovery, help them understand how to make it and and navigate the recovery process, if you will. There are AA tips for finding a suitable sponsor. Find somebody who has a good track record of active participation in AA, willingness to share, honest, hardworking, record of sobriety, these kinds of things. And then they really kind of help you be sure that you're attending meetings, that you're doing your step work, and you're kind of progressing on the road to being a more caring, giving, involved person, as AA sees the life of an addict as self-centered and egomaniacal.
So what I wanted to stress again, we're going to post this article that you've written, and look, there are a lot of research grants that go out, and a lot of people doing extraordinary research on the issue of substance use. What is interesting to me about AA and NA is that these are basically organic organizations. There was no venture capital behind it. There was no federal funds, etc. It grew out of a common need, and I think the origins go back to 1935 and a chance encounter between Bill Wilson, who I guess gets known as Bill W., and a guy, Dr. Bob Smith, who was a doctor. And it grew organically as a self-help organization. And I'd like to say, and obviously it's international now in scope, but these problems have been around since time immemorial. And we were talking about at the beginning, you mentioned, you were afraid that got tired of talking to you, and how can one get tired of speaking about an issue that's not going to go away, okay? And constantly, people have to be reminded. But the fact that this arose on an organic basis, it may not have all of the scientific data around it, but it is evidence-based. And you're writing the article summarizing I'll call it the simplicity, obviously a complex problem, but the simplicity of the approach and the common sense that gets applied to it now through AA, NA, etc. It's very profound, quite frankly. I'm not sure it's been studied in business schools yet, Mark, but it should be, because it has sustained itself through now 100 years practically.
Well, that's a good history. I do think it's from the 1930s, and it's just interesting how AA doesn't have promotion. There's no TV commercials, and it doesn't seem very glamorous, and isn't, and it's hard work. I just think it's often made an either or. Like, if you have a substance use disorder, it's true that you should get a comprehensive medical neurological assessment. And if they find something wrong with you, which often is the case in people with substance use disorders, just because the drugs cause diseases, how they're used cause diseases, the lifestyle cause diseases. And, it's one of the things that Herb Kleber used to say, if you have a substance use disorder, do you think you eat right? Kleber, it was always so funny thing. He'd say, like, do you think you take care of your teeth? I mean, are you brushing your teeth and flossing? Like, like, let's not be ridiculous. Of course they're going to have these problems. So it isn't to say that AA replaces physical, mental evaluations and treatment for what's wrong. It doesn't mean to say it replaces detox or medication-assisted treatment, but it is to say that as far as long-term sobriety is concerned, preventing relapse is concerned, it has a lot to offer. So much so that I can't imagine physician treatment and putting someone back in community responsible for others' safety as a doctor, without the person having changed their focus from themselves and drug taking.
The point you're making about co-occurring diseases, whether depression, anxiety, things that can lead to self-medication and things like that. There are other things that have to be treated. So once again, emphasizing a tool in the toolbox, but a proven one. I'd like to just end just in something I just happened to see. As you know from our exchange of emails late at night, Mark, I'm up late, and often working. But I do like to put something on in the background, and it might be sports or sometimes a movie that I've seen umpteen times, and just so I don't feel I'm truly working until 12 or 1 a.m. But there was a documentary on last night on HBO that I wasn't planning to watch. I just happened to find it as a process of channel surfing about Muhammad Ali. My name is Ali, I think is the name of this, or something close to it. My name is Muhammad Ali. So obviously a fascinating figure, but what captivated me, and I stopped working, Ali fought several times a man from Chicago, a fighter from Chicago by the name of George Chuvalo. And he actually is part of this documentary doing the narration of about Ali and what a great fighter he was and what it was like to be in the ring. And Chuvalo lasted 15 rounds with Ali in a fight. Didn't win the fight. Ali clearly won it. But what became very, very interesting was the documentary actually talked about Chuvalo's personal life. And he lost 3 kids to drugs and a wife to suicide as a result of the loss of the children. And he was describing what had taken over his sons' lives. It was heroin addiction, by the way. And you see a guy who is, all intents and purposes, a fascinating life in terms of his work history, but big and powerful and strong, and he made a living in the ring, very articulate and such, and but powerless when it came to his kids and what happened to them. And you just see, he talks about after the loss of his wife and I think third kid, he couldn't get out of bed, and the depression that set in and everything. And you realize there's a powerlessness around this issue. But I'm also reminded, because these events took place many, many decades ago, that people really have not had access to the right information, the right insights, how to think about this, what to do, what can be done, what has worked in the past, what has not. The the body of evidence about this being chronic and a relapse, and what people need to get them back back into being a cucumber, Mark, if I can use that metaphor. And so I was thinking, knowing we're doing the podcast, but just, if Shivallo had the benefit of, and I don't mean this just about you, but the body of knowledge that's out there now, but had been reading the articles that you've been writing for Psychology Today most recently, but other places, that, his ability to fight, and I'll use that verb, to fight through this issue with his kids, the outcome might have been very, very different. But it was not available to him. But it was really just a very, very poignant reminder of the depth of the loss and the suffering that continues. And without getting, I'll call it morbid about this, but one father described to Mike Lesser and me what it was like when lost a child to this, and he said it's like having a pebble in the shoe, and every place you walk, you feel it, every place you go, and that very much came through yesterday when I was watching this. So, long-winded way of saying the longest war, and it continues. But the insights that you're providing, and the fact that you're sharing the body of your experience and knowledge, over 40 plus years now, it's invaluable. So, so much for my op-ed piece about this. Yeah.
No. I mean, yeah, I appreciate it. It's you make people like to describe substance use disorders as like diabetes. But we probably now have treatments for diabetes that reverse it. We'll have better and better treatments. And we could give a person a treatment for diabetes against their will. It's kind of a fun way to look at this. In addiction, we don't have a treatment that would do the same thing. I mean, I can't reverse the person back to a cucumber. I could give someone insulin or Ozempic and reverse a type 1 or a type 2 diabetes, and the person doesn't have to do anything, really. They don't have to change their whole life, go to meetings every day, stop eating a certain way. It's the active participation of the patient who acquires a substance use disorder. It's work, and they actually have to do it. So that I just think there's no magic bullet, and it's very, very hard work. It's why people like you and Michael and I and others work so hard on education, because prevention's the only treatment we have right now that's 100% effective.
Point well made, and as you and others have talked about, the physical therapy that's often required after surgery, and as you say in the article, it works, but you have to work it. So, yeah. So, Mark, thank you again. Look forward to our next conversation, and keep writing, keep sharing, okay? And really greatly appreciate it. Take good care of yourself.
Thanks so much.
Thanks for listening. Be sure to check out Dr. Mark Gold's full bio and host of written publications at the link in the episode description. Want more RANE content? Subscribe to the RANE podcast series today, available on all platforms, or visit our website at ranenetwork.com. That's RANE network.com.